Hello, my name is Richard Gant, and I'm the CEO of Innovative Healthcare. I'd like to welcome you today to a discussion on the benefits of adding fall assessment testing to your practice. However, before we get into the main topic, I'd like to pose a question that many doctors struggle with.
Which is more important, helping more patients or making more money? I submit that what you'll hear today will allow you to do both. Let me set the stage for our discussion by asking you this question.
If you could provide a unique, regulatory compliant program that is easy to implement and your staff does 90% of the work, which will help hundreds of your patients eliminate needless pain, suffering, and even death, and could earn you an extra $250,000 to $300,000 a year, and in some practices $300,000 to $1 million a year, in net profits, would you be interested? If you think you might be interested, I'd like to introduce you to someone else. He will be covering the details of our program and sharing with you why we started offering fall assessment programs to our clients.
Thanks, Rich. We actually stumbled onto the problems facing most elderly patients and many doctors and all insurance companies and their subsequent solutions all by accident, literally. Rich and I both had the same experience a few years ago. My mother was living in Lake Worth, Florida. A couple months short of age 95, she was doing great. She was still driving her car, living independently at an adult community, and believe it or not, still playing golf. One day she got a dizzy spell at home. She fell and she broke her hip. Dr. Kugler was her orthopedic surgeon. He did an excellent job doing an ORIF on her, and their surgery went very well. She went into Pinecrest in Delray Beach for rehab. She did great there, returned home, and then unfortunately passed away within 5 months from cardiovascular and respiratory causes. Rich's mother-in-law had almost the same scenario. She was age 86, fell and broke her hip following a dizzy spell, and then was also gone a few months later. Imagine if that were to happen to your mother, your grandmother, or other family member. It was then that we started looking into what caused these events. We spent several months searching the internet, reading hundreds of articles, and studying many of our most prestigious medical journals. What we learned was shocking. Falls among our geriatric population are reaching epidemic proportions, and I'm afraid this problem is not being addressed sufficiently by most physicians or clinics nationwide. If you really study the problem as we did, you will find that more than 90 million Americans aged 17 and older have experienced a dizziness or balance problem. In addition, according to the United States Center for Disease Control and Prevention, each year more than 1/3 of Americans aged 65 and older, approximately 13 million altogether, will experience a fall, and nearly 16,000 of these people will die as a result of those falls. As a matter of fact, when you study the problem, those patients that are injured so severely that they're hospitalized and then have to go to either a rehab or nursing home setting, approximately 340,000 each year, at the end of the first year, 25 to 33% of them are deceased, and 50% of them never get back to full activities of daily living. My question is, what are you going to do to help ensure that your patients and family members aren't one of these people? To make matters worse, we also discovered that 50% of patients complaining of dizziness in a primary care setting are not diagnosed, and 70% of the patients complaining of dizziness in a primary care setting only get a prescription for meclizine or the brand Anavert. Historically, when a patient presents with dizziness or balance problems, physicians would normally do one of two things. First, they would give the patient meclizine or Anavert, and second, they would refer them to a specialist. I remember my own experience as a family physician. I did what every doctor did at that time. We used to shotgun all of these patients that were dizzy with meclizine or Anavert, 25 milligrams TID. I thought we were helping the patients because acutely in the first week or so they seemed to be a little bit better. However, research today shows that if you maintain older people on meclizine more than a week or so, they potentiate to it. and the older people whose reflexes are already poor when they first present at your office, with meclizine the reflexes worsen. After they've had one serious fall, it becomes a cascading event. First of all, they're afraid to do a lot of ambulation because they're afraid to fall again. That becomes a self-fulfilling prophecy because with limited activity, they're actually more prone to falling. Basically, a lot of them become socially isolated, and we started to see that there was something that had to be done about this. Another reason we found out why more doctors aren't offering a fall assessment program is because in the past, the only equipment available for testing patients with balance problems were ENG systems. They were highly complicated, they took over an hour and a half to perform, and if you weren't an audiologist, it was difficult to even run the equipment. To make matters worse, the interpretations were impossible. If you weren't a boarded neurologist with 10 years experience, then you couldn't even figure out what the heck was going on. This all changed around 2003 when manufacturers came out with new computerized VNG systems, and everything seemed to improve. The procedure time on a patient is now down to 20 to 25 minutes. The results are totally computer generated, so you don't need to go to school for 2 years to figure out what's happening. The new and improved systems use an infrared computerized goggle. Therefore, there's no further need for electrodes, and consequently, there's no further need to have consumables. Patients don't like electrodes because females had to remove all of their makeup, and older people who have senile skin, when you peeled the electrodes off, they often got purpura. Sometimes they even got bleeding. With the goggles, there's nothing to take off the patient's skin that would be irritating to the patient. Additionally, the new system not only does horizontal and vertical nystagmus, it's also excellent with torsional or diagonal nystagmus. Our VNG system is the only unit that has built-in active head rotation. It replaces the need for the old Barony chair. The Barony chair weighs 800 pounds, it costs $125,000, and permanently it takes out the availability of a doctor's examining room. We're the only manufacturer that has it. There's a separate CPT code for the active head rotation, and that code is 92546. In general, it adds approximately $180 to $200 additional reimbursement. Lastly, most of the more comprehensive systems also contain a caloric irrigation system. In the past, the caloric units were miserable. They used to involve putting water in the ear canals. If the patient had the slightest hint of a ruptured tympanic membrane, they got into havoc with nausea and vomiting. Today, the caloric systems are air calorics, and that morbidity has gone away. We also noticed that in addition to the pain, suffering, and even death to our senior citizens, the costs to insurance companies have been going through the roof. 5% of falls lead to bone fracture. This results in approximately 340,000 hip fractures annually. There's an estimated cost of $20.2 billion for the treatment of these fall-related injuries. Unbelievably, the total cost of fall injuries among older adults is expected to hit $54.9 billion in 2020. Because of everything we've discovered, I must admit that we were shocked that so few doctors, specialists or otherwise, were offering this type of service. So we decided to find out why, and here's what we've discovered. Most physicians don't realize there's a problem, because most doctors are typically reactive instead of being proactive. Unfortunately, for too many patients, most doctors today are typically in a reactive mode. They simply address the complaint that the patient presents to them instead of being in a proactive mode where they're actually looking for a problem. They are missing most of the pathology because patients are keeping their complaints to themselves. This is most prevalent when it comes to potentially life-threatening dizziness and balance problems. Our research has proven that most doctors are missing about 90% of the pathology in their practice when it comes to balance problems. We find that if a doctor says he or she only sees 2 to 3 patients a week who are coming in complaining about dizziness or vertigo, when they survey all of their older patients, they are usually finding 20 to 30 patients who could benefit from the assessment testing. Because of these findings, we believe that a proactive approach can help eliminate needless pain and suffering. Most of the pain and suffering associated with balance problems, including premature death, can be avoided by physicians who take a proactive approach and ask their patients if they have experienced any problems or concerns related to dizziness or balance before they receive a call from the emergency room. What we are offering is preventative medicine at its finest, and insurance companies, including Medicare, don't mind paying for it. It is saving them hundreds of millions, perhaps even billions of dollars each year. When I got involved with this project, I assumed that every ENT and neurologist was already providing the service. However, I found out that they were not. Actually, very few physicians are offering it, specialists or not. It seems that ENTs are in the bread and butter in the operating room, and they're content doing surgical procedures, so few of them have developed vestibular practices. In the field of neurology, some doctors do have the older equipment, the ENG systems, but very, very few have the modern VNG systems. That's one of the reasons we started contacting them first. Although some of them embraced the program, many were either too busy performing surgery, or didn't have the time or interest, or they were so successful they didn't need or want any additional income. The more we looked at the situation, the more we realized all non-specialty physicians in the U.S., these are the primary care doctors, internists, and family physicians, see 10 times as many older patients as all the specialists we targeted combined. We're talking 36,000 specialists versus 360,000 primary care physicians. Since a significant percentage of the older population exhibit balance problems or symptoms of same, who is better equipped to handle the screening than the doctors who see the largest number of these patients? Our objective is to help as many seniors as possible. So why only help eliminate unnecessary pain and suffering and even death for 10 patients when you can help 100? Our mission for the last 12 years has been to help physicians find new and technologically advanced equipment and cost-conscious treatments to offer existing patients and attract new ones. However, we don't just sell equipment. With over 35 years of combined experience in medical equipment sales, practice building, and targeted marketing, the IHS team is ready to demonstrate how you as a medical professional can employ new ideas and equipment to diagnose and treat diverse illnesses in a cost-effective way. Use trained medical assistants to administer and monitor some of the programs and receive a worthwhile reward for your efforts. After the loss of family members and all the research we did looking into this problem, we decided to focus our efforts on helping reduce the problems older people are facing regarding fall-related injuries. We analyzed what it would take for doctors to be successful providing fall assessment programs. And here are the 6 components we knew we had to provide. Number 1, the most effective and cutting-edge fall assessment equipment that can pre-screen patients to justify more in-depth testing and also provide comprehensive diagnostic VNG and caloric testing, including active head rotation for additional accuracy. Number 2, comprehensive on-site, in-office training plus ongoing support to train staff members and assist the doctor and billing staff when necessary. Number 3, a program that is easy to implement and the staff members do all the work instead of taking more of the doctor's limited time and energy. Number 4, a powerful and proven patient education and physician referral program to ensure the doctors help all the patients possible. Number 5, CPT coding that is standard and accepted so that the doctor gets paid without a hassle from Medicare or other insurance companies. Number 6, substantial additional income for the doctor and practice with little or no risk. If you work with us, we provide a complete turnkey system and full assessment program. If you haven't already received one, call us now for a personalized income projection and program proposal. Okay, let's cover each of these components one by one. To be able to provide a comprehensive full assessment program in your practice, you should have 3 different pieces of testing equipment. First, you need a balance plate like the one shown. We call our balance plate the Balance Plus Full Assessment System, or FAS for short. This patented diagnostic device can identify a person at increased risk of falling in less than 60 seconds, providing the clinician with immediate, quantified, age-based norms and automatically flagging a patient who fails the balance test, calling the physician's attention to the patient's problem so the physician can decide if further assessment is needed. Next, you should have a V&G system. V&G stands for Video Nystagmography. Our Balance Plus V&G system is the most state-of-the-art system available today. We offer cutting-edge technology that is now available as a portable system using the latest laptops. Our system offers a complete real-time eye movement analysis technology that meets the demands and standards for V&G testing. While comfortable for the patient and easy to use for the clinician, our V&G system enhances the effectiveness of a diagnosis. When testing patients with this system, you'll wind up with 3 types of patients after the results come out of the machine. A small percentage will be normal. You bring these back a year later for repeat testing. Another small percentage, perhaps somewhere between 8 and 12%, will have central pathology. Those patients you're probably going to refer to a neurologist. They may need additional workup like an MRI of the brain, evoked potentials, and probably EEG. But the vast majority of patients will have what's called BPPV. It stands for Benign Paroxysmal Positional Vertical. In case you don't know it, the design of our system was done at the House Ear Clinic in Los Angeles. It is one of our nation's leading neuro-otologic institutes. Doctors John and Howard House, ENT surgeons, developed this system. They developed the software for the automatic interpretations, and they were the ones who came up with the active head rotation. They also trained the residents out of the USC program, and they still use our system today. Last is the caloric irrigator. We recommend the Balance Plus Caloric Irrigator 2. Caloric irrigator is used for dry thermal examination of the vestibular organ by means of air. Special features provide extremely precise temperature control and an exact dosage of the airflow. Our air caloric irrigator avoids all of the problems previously associated with the older water calorics. For more information on these 3 units, be sure to visit our website at www.balance-plus.com. That's www.balance-plus.com. Now let's talk about the comprehensive on-site training we provide. The following is a list of some of the extensive services we provide that makes owning a Balance Plus full assessment program simple, easy, and extremely profitable. 1. In-house training program with you and or your staff. This consists of 2 to 3 days of hands-on training on the equipment. We train your staff to do all of the testing. 2. In-house training program to help train your billing staff. We cover the proper CPT coding and also the ICD-9s with your billing staff. We answer questions regarding unique billing for vestibular testing. 3. In-house training program with your front office and back office staff. This consists of training the front office staff regarding the use of the dizziness patient questionnaires. This also involves a discussion on how to easily integrate full assessment testing into the practice. Now let's cover some of the ongoing follow-up and support we provide. Our ongoing consulting and follow-up support consists of professional assistance with interpretations and analysis of reports, phone conferences with doctors and staff to address all the issues and concerns that may arise as you use your new V&G system, manuals with printed forms and explanations, and a CD with all the forms in Word format that are necessary to implement the program will also be provided. Details on the training and support are covered in our We Do It All For You program proposal. If you haven't received one yet, be sure to call our office. Our phone number is 800-526-5557 and order the material. Or you can find a copy on our website, again at www.balance-plus.com. Let's move on to the third component. This fall assessment program fits into the flow of any practice. First, you hand out the survey. You check the answers. Your staff marks it for the physician. You put the patient on the balance plate, just like taking vitals and checking blood pressure. It's that simple and easy. The unit takes up very little space. It can fit in a 2 by 3 foot area. It can be put on a mobile cart, just like the Lakeside cart. It can be put away when not in use. It is very flexible and convenient. There are 2 to 3 days of certified training for staff members. Your staff learns and practices. They become very proficient. When our trainer leaves your office, ongoing support is provided. Thousands of staff members nationwide are doing this.
Innovative Healthcare provides various levels of marketing and educational support to help ensure that doctors with balance and fall assessment equipment can be more successful. Utilizing our materials and programs, you will be able to share your fall assessment program with many more patients and referring physicians as well. At this point, I would like to bring back Rich to explain our patient education and doctor referral program. Rich? Thanks, Doc. In our effort to provide the best support possible, after we sold several programs, I followed up with the doctors to see how they were doing. And I found that many of them were only helping 10 to 15 patients a month instead of 40 to 50 a month. When I analyzed each of their situations, what I learned was that they were only testing the patients who complained about dizziness. They were missing most of the pathology. That was when I went to work to design a patient education and doctor referral program to help them help more patients by becoming more proactive. Our patient education and doctor referral program includes many strategies and tools to help introduce the program to more patients and get a lot more referrals. The first tool is a unique fall assessment survey, which is designed to determine if patients have fallen in the past or may be predisposed to falling in the future. It will help you advise them about how to prevent falls and or identify any problems they may have so that you can suggest appropriate treatment or additional testing. In addition to the first tool, we also provide a professional consulting company that will provide comprehensive staff training on how to hand out surveys and magazine reprints to existing patients in order to identify additional pathology that your patients may have but are not sharing with you. Before we get into ways to motivate your patients and other doctors to refer their friends and patients to you for balance testing, let me give you an overview of how we suggest you implement this program.
We suggest that you go through a 3-step examination process. First, step 1 is a fall prevention balance and dizziness survey. Your receptionist hands out the survey to everyone in the waiting room, or at least to the older patients. It only takes patients a couple of minutes to fill out a survey. They check off an answer, yes or no. The questions are obvious. Do you get dizzy? Do you get dizzy in the car? Have you fallen? Do you fear you may fall? The last, fearing of falling, is a very big concern of older patients. Most people will be in your waiting room for some reason other than dizziness. In most practices, we found that 75%, sometimes as high as 100% of patients over age 60 will answer yes to one or more questions related to dizziness. This gives you a subjective criteria regarding the patient's concern about falling. Because of the significant increase in patients who may have balance problems and the subsequent increase in reimbursements from insurance companies and Medicare, we suggest that those patients who give positive answers on the questionnaire should then go on to step 2. They should be tested on the Balance Plus fall assessment system. This utilizes the balance plate, which takes up about 18 inches, the size of a large scale. It minutely measures abnormal sway. Recent studies show that abnormal sway is the biggest predetermination of early onset vertigo or nystagmus. The plate's computer prints out a detailed posturography report. This report gives you objective criteria regarding the patient's need for additional testing. Anyone who fails the plate is brought back electively on a different day for Step 3. And Step 3 is the VNG and caloric testing.
Thanks, Doc. In addition to the survey and training, the program also consists of 2,500 4-page custom-made magazine reprints featuring you on the cover of Innovative Healthcare magazine and including a 3-page interview with you citing the need for extensive fall assessment evaluations and the benefits of your fall assessment systems. These reprints can be handed out to patients, passed on to your patients' friends, and sent to referring physicians that position you as a national expert on fall risk analysis and prevention. We also provide a comprehensive 150-page patient education and doctor referral training manual that you or your staff can refer to with scripts, letters, and insights into how to build a powerful image, concepts and programs to distinguish you from your peers, and methods and materials designed to get referrals from past and present patients, as well as referrals from other healthcare professionals. If you get our Platinum Marketing Program, you'll also get a professional marketing company that will tailor a direct mail campaign for you to reach up to 500 physicians in your local area, which will include a personalized 2-page letter and one of your reprints introducing you and your practice. Details will be provided about the availability of your fall assessment program, which will help patients determine if they have any fall-related risks, along with instructions on how to contact you. We also have skilled professional assistants who will follow up by phone with these targeted physicians who were sent your letters and reprints in order to see if the doctor received your information. Our staff will determine if that doctor might be interested in talking with you or if they would like to refer their patients to you for more sophisticated evaluations regarding problems with balance, dizziness, and vertigo. In addition to what we have covered so far, you also get various articles, press releases, and newspaper ads written for you, which can be sent to local, regional, and national print, television, and online media sources to create news stories and publicity about you and your clinic. Finally, you get 5,000 4-color deluxe pre-printed postcards featuring you on your magazine reprint cover on one side and an invitation for them to call your office for a copy of the reprint, along with a limited time offer to receive a free consultation and/or balance test, assuming you have the balance plate on the other side. These postcards can be sent out to past and present clients and given to patients to give to their friends to motivate them to take advantage of your offers and services. To sum it all up, the total value of our comprehensive and proprietary patient education and doctor referral program is more than $7,500.
Thanks, Rich. Before we get into the income potential, let's touch on the 5th component of this program: valid, proven, and accepted CPT coding. Listed on the screen are the CPT codes used for VNG and caloric testing. Rather than taking the time here to go over the codes in detail, I suggest that you visit our website where there's a detailed explanation of all the coding used in our fall assessment program, including the codes for the balance plate and comprehensive office visits. Now let's cover the final point, number 6, and briefly talk about what it means to you financially to add a fall assessment program to your practice. There are 5 potential sources of income from this program. Fall assessment testing, the FAS. The Balance Plus Fall Assessment System is designed to quantify a person's ability to maintain balance through postural sway measurements. Increased postural sway is a strong indicator of poor balance and a leading cause of falls. Using the Balance Plus test protocols, a clinician may determine the cause of the balance problem or that further testing is medically necessary. This test takes only 2 to 3 minutes and can be done by a staff member along with checking blood pressure and weight. Balance Plus VNG testing. This is the VNG system. Testing will typically take between 30 and 45 minutes, and your technical staff member will easily be able to perform 6 to 7 studies per day. Again, this can be done by any staff member who has been trained by our certified trainer. It does not have to be performed by the doctor, which frees up the doctor to continue helping his or her other patients. Comprehensive office visits. First, to discuss the need for more complete diagnostic testing prior to providing the V&G and caloric test, and secondly, after the V&G testing is completed, to discuss the need for vestibular rehabilitation or other recommended treatments. Fall prevention training. This is our optional FAST program. Typically, about 75% of these patients tested will require vestibular rehabilitation. Each patient will go through between 5 and 10 one-hour sessions spread out over 30 days. It is our understanding that in order to get reimbursed by Medicare for these treatments using physical therapy CPT codes, the physician must have a physical therapist on staff. Honorarium for being a Balance Plus demo site. A Balance Plus demo doctor is a physician who has purchased the Balance Plus Fall Assessment and V&G systems, has been through the complete training process, and has demonstrated proficiency in the use of the equipment. He or she or a trained staff member should be able to demonstrate the equipment, answer technical and clinical questions, and have a strong level of certainty when it comes to the results possible using the Balance Plus equipment and testing procedures. For providing demos to doctors we refer to you who are interested in purchasing our equipment, we will pay you an honorarium of $2,500. We are getting close to the end, so let me take a minute or so to summarize the benefits for you. You are already paying for the rent, lights, insurance, and staff. This doesn't increase that, so it fits easily into the flow of any practice and does not increase overhead. This program is set up to maximize your current patient flow, so no advertising is necessary. Patients come from your existing patient base. With the marketing we provide, it is also easy to get referrals from patients and other professionals. Because this equipment is very compact and portable, it takes very little space to provide full assessment testing. The equipment can be put on a mobile cart for more flexibility. Most important, the doctor has little or no involvement of his or her personal time. This is called passive income because the doctor doesn't do the testing. There is very little work for you to do because staff members are trained to do all the work. Your job would be to look over the reports that would be generated by the equipment, sign the reports, and date them. Since this equipment and testing procedures are not experimental or investigational, they have proven and accepted CPT codes that insurance companies and Medicare are willing to pay for without a hassle. Best of all, adding a full assessment program to your practice means an inexpensive startup. The cost is only $99 a month for the first 6 months. Before we end the webinar, I would like for Rich to discuss our Demo Doctor program.
Because of our track record with helping our clients to be more successful in providing good service and support, the manufacturer of this equipment has chosen IHS to exclusively promote this equipment to as many doctors as possible. Because we don't have the time or the staff to travel all over the country, we are looking for one doctor in selected areas to be our demo site. As our demo site, you would use this equipment to test your patients, as well as patients referred to you by other MDs and DOs in your area. You or a designated staff member would demonstrate the equipment to other physicians referred to you by us who are considering purchasing the equipment for their own practices. We would refer them to your office by appointment. One of your staff members would demo the equipment, which should take about an hour. Whether that physician buys the equipment or not, at the end of the month, we give you an honorarium for your assistance. In addition to treatment revenue, which as we discussed before is typically between $15,000 and $25,000 a month, you would earn up to $2,500 for each demo your staff performs, and you would also earn up to $500 for any phone consults that you do with interested doctors. Now, federal laws and regulations prevent us from rewarding you just for successful outcomes. So again, I want to reiterate, whether the doctor purchases the equipment or not, you still get the honorarium. We're not expecting you to be a salesperson. We want you to be an educator. If you qualify to be our demo site, which is on a first-come, first-served basis, so don't delay, in addition to paying you a $2,500 honorarium for each demonstration one of your staff members perform, you will also receive our $10,000 fall assessment system, that's the balance plate, for free. And in addition, you'll receive our $7,500 patient education and doctor referral program, which includes 2,500 magazine reprints and 5,000 personalized postcards, all at no cost to you. Since we're only looking for one doctor to be our demo site in any given area, if you want to put off your decision, that's fine. All we ask is that if we are already talking to you, please let us know that you aren't interested at this time so that we can find someone else for this opportunity.
To conclude, if you want to know what it takes to get started offering fall assessment in your practice, or how you can qualify to be a demo site, or how you can get your own personalized income projection, or we do it all for you proposal sent to you, give me a call at 800-526-5557. And thanks for listening.